시청자 여러분 안녕하세요.
Dear viewers, greetings. This is Prosthodontics on Friday, which addresses different stages of prosthodontic treatment as well as its side effects. Today we have with us Professor An Jin-soo of Seoul National University Dental Biomaterial Department. He's going to speak under the theme Current Status of Zirconia as Material for Implant Prosthesis. Greetings. I'm sure you're busy teaching and researching, and thank you for preparing a wonderful lecture. Could you please briefly introduce your lecture for today? The title is The Current Address of Zirconia as Material for Implant Prosthesis. I'm a basic scientist. I'm going to talk about basics of zirconia as well as history. I'm going to talk about the zirconia in two aspects, aesthetics and physical property, and also talk about zirconia where it's at today. My understanding is that not only did you complete the basic science, but you also completed residency in prosthodontics, so you do both basics and clinical application as well. After listening to you speak about your lecture, I'm even more intrigued. Those of you watching from dental site, you can communicate real time using the chat screen, leave your questions, and these will be addressed. Starbucks coffee coupon will be sent as well. We have prepared a new event for those of you who love prosthodontics on Friday. The event will go on in April and May. If you leave your questions, the best question will be chosen and the winner will receive a dental set from Busen and Music Tiger. Study about prosthodontics and win the cute little Music Tiger and Busen dental set. I'm sure your kids will love it. You need to agree to marketing and dental site to be able to receive the gifts. I like to make one more house cleaning announcement. Dental has created a Kakao Talk channel at the channel and receive news about dental programs and events in an easy and swift manner. I look forward to your participation and interest, and let us begin Professor An Jin-soo's lecture. Today's topic is the current situation of the zirconia for implant prosthesis restoration. I'm going to talk about basics and history of zirconia as well as aesthetic and physical property. I'm going to talk about latest trends as well. First, what is zirconia? Before we talk about where the zirconia stands today, I want to talk about basics of zirconia. It looks too elementary, but you need to understand this to be able to understand zirconia fully. Zirconium is metal, and if it combines with oxygen, the oxide is zirconia. This is what we call ceramic. What is ceramic then? It is carbide, oxide, and nitride, which has combined with metal. And zirconia is what has resulted when zirconium combines with oxygen. There's common factor in ceramic. It is hard and has a high resistance to wear. However, it is brittle, and this is a very serious problem in terms of dental restoration. WC, does it stand for toilet? Toilet is actually ceramic, however, WC stands for tungsten carbide. Tungsten carbide is used in burr, which we use daily. Tungsten is metal and carbide of tungstenel. In other words, it's ceramic. It has high resistance to wear and it is used for cutting. In order to compensate for the brittleness, it has been combined with metal like cobalt. That's why burr looks like metal. Let's look deeper into zirconia. It doesn't look interesting, but we need to study. Zirconia's melting point is 2,700 Celsius. From room temperature to monoclinic phase and tetragonal phase, which exceeds over 1200 Celsius. And if it exceeds 2400 Celsius, it has a cubic phase. If you increase the temperature, yttria or magnesia and other stabilizers, if you use it, it does not return to monoclinic. It maintains the phase, say cubic phase or tetragonal phase, even when the temperature drops. I'm sure you know of cubic zirconia, and this is zirconia which has been sterilized in cubic phase. And that's how you make a cubic zirconia or artificial diamond. I'm going to look at the terminology briefly. It looks very complicated. TZ, PP as Z, and Y as Z. It's too complicated, so I'm going to skip this part. But these terms reflect the fact that it's tetragonal phase, multifaceted zirconia partially stabilized with yttria. This encompasses it all. Different terms came to be as different names were given to different traits for dental zirconia. There's a unique zirconia characteristics. I'm sure you've heard of this. It's transformation toughening. Why does this happen? This is because the volume is bigger in monoclinic phase than tetragonal phase. Why does ceramic crack easily? You see that there's a crack. Once there's a crack, it progresses rapidly. That is the characteristic of ceramic, and that is why ceramic can break easily. As the crack progresses, because of this crack, tetragonal phase changes into monoclinic phase. Because the volume increases, the crack cannot progress. As it expands, the crack is stopped. Except for this characteristics, zirconia is no different from existing ceramic, which is brittle. Therefore, that's why at times you see zirconia chip like porcelain. This is why. I'm going to talk about history of zirconia. In order to know the present, you need to understand the past. And I found another saying. In order to understand the present of one nation, you need to visit the market. The dental companies in Korea have adopted new technology rapidly, and therefore, looking at dental market can help us understand where we are in terms of dental material. Let's move on to history. The partially stabilized zirconia was first introduced in 1970, so 50 years ago. After 10 years, it was applied in the medical field in 1980s. It was applied in femoral head or the hip joint. It was applied in the dental field 10 years after that because in 1990s, CAD/CAM system was introduced, as well as the milling system. As you know, the first zirconia system was fully sintered. It was very hard and there were many problems. There would be wear on burr. 10 years passes, and in 2000s, half-centered, so it's not fully centered zirconia was introduced. And you would cut that zirconia. And with that, the era of zirconia started. CAD-CAM, in which we design in computer, you consider the amount of shrinkage upon centering with computer, and then you design it bigger. As this is made possible, the era of zirconia dawned upon us. As you can see, the physical property of material is important, but clinical applicability is also very important. Depending on clinical applicability, the availability or usability of the material is determined. The concept of fabricating prosthesis with milling half-centered zirconia is still used. It is still mainstream. The difference with the early system is that we only used zirconia for core of ceramic restoration. On the occlusal surface, a general ceramic was used. PFZ, porcelain fused to zirconia. This replaced PFM, porcelain fused to metal. Zirconia replaced the metal. There was a reason why zirconia was only used for core material, and I can tell you two reasons. First is opacity of zirconia. Compared with a person's tooth, especially the enamel, it was opaque, so you could not use it in the interior area where aesthetics are important. This was inevitable. Another problem was related to the binding between zirconia and ceramic, and because of this, fracture and chipping occurred. The use of zirconia in terms of hardness, so you had to let go of the benefit of hardness and you had to choose aesthetics instead. First reason was the opacity. And before I go into the second reason in terms of the relation with the antagonist, I'm going to talk about aesthetics of zirconia. We have just flowed right into the aesthetics of zirconia. We need to talk about translucency as well as color when we talk about aesthetics. In the case of color, in the early stage, zirconia was only used as core and was only used as the basic color. On top of it, you'd add veneer and porcelain. Thus, the impact of color was not significant. The color of zirconia was not really important. On the early stage, you would mill the half-centered block, and before final centering, you would dip it in a colored fluid and add color. As you can see, the color was not really done properly up to the core. So matching the color was a very difficult job. Since then, there has been many developments. Korea is very quick to adapt the so-called zirconia or monolithic zirconia. The usage of this has increased. Along with it, the importance of aesthetics increased. In the early stage, you would fabricate prosthesis first and add color or stain later. And with development, the block itself had color. These days, as shown, there are gradation block with different colors in it. This is called gradation block. And there are products which add a different material. This is called multi-layer block. There are different blocks available with different colors. The terminology is not set yet, but we call this multi-block. It's technically different between gradation block and multi-layer block. And as shown, there are so many products from China as well. People who use these products say that the aesthetics of this product has reached that of ceramic system. Can I ask you a question? You have introduced multi-layer block. You said that there were many benefits. My concern is that could it really recreate the color? That's my concern. In terms of matching the color, what do you think is the current level of multi-layer block? It's a difficult question. You're right. The color is already defined here, therefore, it cannot really perfectly fit with the patient's color because the patients have different colors. Yes. The job of lab technician can be largely divided into coloring and staining. This is done to adjust the color. These processes are necessary. These products have been flooding the market over the last 3 years, and there are different colors available in multi-layer block. Based on my understanding, you can skip coloring out of coloring and staining, but it still does require staining in order to match the patient's tooth color. Osstem provides multi-layer blocks too. But as we do clinical practice, so in the past, we would add porcelain. We would ask the lab technician to make incisal area A2 and body and cervical A3. In this context, would multi-layer block satisfy such demand? In order to satisfy that, the types would increase exponentially. I believe the final stage needs human touch, and if new technology will be introduced, that will be addressed. So let's look at the comments. This is the real-time chat screen. ID so hot. I really love the live program. Forever Joino. Is that referring to me? I really enjoy prosthodontics on Friday. ID Good Doctor. I'm so happy to see Professor Joino and Professor An Jin-soo in one place. I look forward to today's prosthodontics on Friday. ID 456852 has also left words of encouragement. Thank you for all the encouragements. Is there a question? If you leave your question, we'll answer them real time. Professor An, please carry on. Next, I'm going to talk about translucency, which is more important than color. As you know, dental zirconia's biggest downside is lack of translucency. In implant prosthesis, it can cover and hide the metal abutment. I looked at the translucency of early zirconia. At the time, the zirconia of Zircozan was known to be very translucent. It was more translucent than other systems. However, as shown in this diagram, compared with lithium disilicate or Emax press, the translucency falls far short. A lot of research has been done to improve translucency. I also did it myself. The first thing I did was adjusting the molecule size. The realm of the molecule size for dental zirconia is defined, and I've noticed that in this scope, the smaller the molecule size, the better the translucency is. The conclusion that I reached is that the molecule size increases with increased sintering time. Therefore, if you reduce the sintering time, you can improve translucency. This was 2013 when the microwave sintering system was just introduced. Microwave sintering was first introduced then. I used this in this research. Microwave sintering. You can think of the principle used in microwave. Induction heating is used, so sintering is done extremely rapidly in very high heat. I'm sure all of you use induction as well as microwave. It has the same working principle. You're talking about using microwave in doing zirconia sintering. Considering the pros and cons, do you actively recommend using it clinically? I have another question. It's not really distributed yet. Why isn't it widespread? I wanted to talk about this topic exactly. The reason why microwave sintering was introduced was to reduce time. These were introduced to reduce time, but early systems, there weren't sufficient research and there were many downfalls such as reduction in physical property and shrinkage of prosthesis as well as deformation. At the time, when we think about making prosthesis, we would send it to the lab, and after a couple of days, in the case of dental hospital, you wait a week, you receive it and provide it to the patient. Therefore, reducing 5 or 6 hours did not mean much. That's why it wasn't really adopted. However, I believe microwave sintering has improved significantly, and recently, a lot of people fabricate prosthesis within the dental clinic. You start making in the morning and provide it in the afternoon. If you have that kind of system, time reduction can be very significant. The need to reduce time has increased, and I believe more research needs to be done. With further research, I'm sure new opportunities will be uncovered, leading to more widespread use. So at present, it's not really widely used, but in the future, there's potential. Talking of which, let's look at some of the questions and comments. ID, Blooming Spring. Professors, you two look dashing in vests. Thank you. ID Toto, there's a question raised. When you provide a bridge for multiple missing case, I am concerned about fracture of the joint. How thick should it be? I believe Professor Chu needs to answer this question. I'm sure, Professor An, you know this very well. When I was providing clinical treatment, zirconia was not really introduced. It was early stage. Compared with metal bridge, unless you make the joint 1.5 times thicker, fracture would occur. I was kind of negative about using it, but I'm sure things have changed. These days, we mill it. Therefore, accuracy has been improved significantly. In the past, at best, you could use it for 3-unit bridge, but sometimes people use it for full mouth zirconia restoration. Some people do sectioning, and some people just do it in one piece. Depending on the number of units, the thickness of the joint should differ. In my opinion, unless it has negative impact on aesthetics, you need to make it as thick as possible. I couldn't agree more. Because a lot of problems occur related to joint, so you need to make it thicker. That's recommended to avoid problems. In terms of numbers, I'm not sure at the moment. Perhaps 4 to 5 millimeters. I'm not sure if it answered your question. If we have something to add, we're going to reach out later with more information. ID Hotdog 7. Professor An Jin-soo. A lot of zirconia hybrid blocks are released in the market. In terms of material perspective, what is the biggest difference between the traditional zirconia and the hybrid, the ones for inlay? Another very good question. Those who are not really aware, they may think they're very similar. The basics of hybrid block and composite resin are very similar. Within the resin, you put in the filler. The hybrid block, in other words, is supplemented by mixing resin with zirconia molecules. The difference is that composite is placed in the oral cavity directly and light polymerization is done. On the other hand, as for hybrid block, it has better physical property compared with composite resin because the company applies high heat and high pressure and needs better conditions for polymerization. However, this is just adding zirconia on top of zirconia, so there's difference with zirconia that has been sintered and fully fused. Therefore, the hardness is not as much. So the hardness is not as good as monolithic zirconia. The biggest difference is the hardness, yes. ID Pretty Sky, zirconia is really interesting. So dental clinic. Some dentists believe that zirconia prosthesis should be insured by the government. The questions keep getting harder. Personally, if something becomes mainstream, it should become a standard. I did a treatment and patient care as well. I provided treatment in Japan. And when you look at the patients, some of them had metal, not even gold, restorations, and they were pure ugly. They were very unaesthetic. Yes, so there could be finance problems, but personally, if something becomes mainstream, I believe it should be applied. If you do zirconia implant prosthesis, this becomes uninsured. The aesthetic factor cannot be overlooked. However, at present, those with money can afford it even without the insurance. However, those do not have much cannot afford it. I believe the new government is now inaugurated, and I believe if KDA continues to lobby, the zirconia implanted prosthesis may be also covered and reimbursements can be increased. Thank you for the good questions. Let's look at another question. ID Awesome. A couple of years ago, I did staining and matched the color, but when I look at the patients coming in as of late, it's turned white. What kind of demands can I make to the lab to prevent this? I believe the lab had done staining only in the past. I'm not really sure about the lab process, but there's multiple ways to do staining. One type is to just do low heat process and you just apply the color. Or you can do glazing and use high heat. You also do that in general porcelain as well. In this case, the color is fully fused. In this case, the color does not change. My assumption is that if it has turned white, it was not fully fused, but it was just applied. I think you need to tell the lab so that the staining doesn't come off. High heat needs to be used for glazing and thorough staining needs to be done. These days, basic color is matched, A2, A3, so even if it comes off, aesthetically, it's not a major issue. However, the case that ID Osstem is mentioning, probably something other than multi-layer block was used. And by it becoming white, the surface must have turned more rough and scattering must have occurred. So in the future, you should use good multi-layer block and do staining properly. That's the gist, yes. There were so many questions. Please carry on with your lecture. I've talked about how microwave sintering can reduce time. If you look at my test result, the molecule size has become smaller and translucency has improved. This is microscope image. You can see molecules here. Some of the questions are addressed in this slide. Are there only benefits? Not necessarily so. As mentioned earlier, if the molecule size becomes smaller, fracture toughness is decreased, hardness increased. There are many engineering studies on this. Although translucency is improved, the resistance against wear is reduced and many physical properties are reduced. This is a problem in engineering. It's one of the biggest problems. However, in clinical dentistry, compared with natural dentition, the material does not wear too much, so reduced resistance to wear is clinically more favorable. It becomes closer to natural tooth. The zirconia, it has too much resistance, so it can be more favorable. The early microwave system, not much was established in terms of reduced physical property and such. However, the latest products have established the systems, and if you compare the pro and cons, I believe it is a good way to improve translucency for aesthetic prosthesis. That's my opinion. Next, I'm going to talk about the percentage of yttria. I'm sure you're aware of this. In order to improve translucency, you add more yttria, which is a stabilizer. In dental field, everyone is clamoring to apply this. If you increase the amount of yttria, why does it become more translucent? That's why I talked about basics. The cubic phase increases. With increased cubic phase, the translucency goes up. This is actually an established knowledge. However, it did not hold significant meaning in terms of engineering, so no one was interested. But in dental field, even if you reduce the strength, you want more translucency. So if you increase the amount of yttria, translucency increases. That's why it was introduced. Although it causes significant deterioration of physical property, dental field requires clear prosthesis and it has been adopted. The zirconia that we use is 3 mole yttria. You improve and increase the yttria amount to 4 mole or 5 mole. Zirconia with 5 mole yttria, if you look at the molecule size, the microscope, it has increased. And what's in it is the clear cubic phase. So overall translucency and transparency has improved. The cubic phase is above tetragonal phase. The benefit of zirconia transformation toughening does not exist in cubic phase. If you use cubic phase, you forego the benefit of zirconia, so it is brittle and it has a less hardness. As a result, you need to understand that you're losing some of the benefit of zirconia when you use zirconia with high yttria content. Now I will move on to physical property. There are many different physical properties, hardness and strength. Clinically, the most important is possible damage to the antagonist. Monolithic zirconia. Full mouth zirconia has become rapidly widespread. Especially in Korea, the dental field is very brave, so to speak. Everyone is using full zirconia even without scientific basis. With such rapid spread, a lot of people began to wonder, because zirconia is stronger than porcelain and its hardness and strength is both stronger, what impact will it have on the antagonist? As implant prosthesis, implant does not have PDL, and if you put a hard prosthesis on top, it could be an even bigger problem. Therefore, a lot of clinicians thought the zirconia should be avoided for implant prosthesis. In 2010, so 10 years earlier, equipment for wear tests became available at my university. I was curious, so I did the test. To give you the conclusion, if you look at the very left one, this is feldspar material, porcelain. Second is zirconia. When you provide a zirconia prosthesis, the level of wear on the natural and opposing tooth is very low, less than half. Third is coloring glazed group on zirconia. The glazing material itself is low fusing ceramic, so the wear on antagonist is increasing. In the lab, the zirconia causes less wear on antagonist compared with porcelain, significantly so. This has been verified in many studies. Additional test was done. I used Express, the lithium disilicate. Even more than that, the wear on antagonist occurred less. There was something interesting here, the effect of polishing. As you have mentioned, you need to do polishing to prevent wear on antagonist. I checked the level of impact of polishing on antagonist wear. I looked at the study, but there was no impact. I did study and engineering. This is already a known concept, self-limiting concept. This rough surface at the very early stage does have impact on wear, but this also goes through wear. And once this rough surface is worn, the roughness itself is not important, and depending on the characteristic of the substance, the level of wear is determined. The test result, using sandpaper 600 and 1200, a test was done and no statistical significant difference was observed, regardless of whether you do 600 or 1200. There was slight difference, but there's no statistical difference. But I'm not saying that you do not need to do polishing on your restoration. However, polishing with an oral cavity is very difficult, so you do not need to be too stressed. You need not to be overly obsessed. You do not need to worry too much. That's what I wanted to say. This is wear on zirconia after having caused a wear on natural tooth, and this is looked at via microscope. In zirconia, you cannot really see the dent. There's barely a mark. In the case of lithium disilicate, Express, you can see a small dent. On the far right is the feldspar ceramic. It doesn't look deep, but the scope is extensive, and it's quite deep too. It looks very roughly chipped off. You can see that the material of prosthesis, which is in contact with natural teeth, also go through wear. What kind of clinical meaning does this have? As of late, full zirconia has become mainstream, and I believe a lot of you have clinical experience. I don't do clinical side. I don't have experience, and I ask a lot of dentists who do clinical treatment. Based on my experience, I ask whether zirconia cause less wear than ceramic. Most of the time they say no. Most people say that it causes more antagonist wear, and some note that there's no difference. I wanted to know why there was gap between test result and the reality. I've learned occlusion from you, Professor Cho. I wondered, not just the natural dentition, but restoration, they continue to go through wear. If wear does not occur in zirconia and if it remains intact, what would occur to the antagonist? Wear or fracture, destruction of periodontium, and even worse, TMJ problem can occur. One way or another, there's going to be a problem. In that sense, if you use zirconia for implant restoration because implant does not have PDL, it may be very dangerous to assume that there will be no antagonist wear when using zirconia. This can pose a very significant risk to the antagonist. What is interesting is that people think alike. When I looked it up, there were a couple of clinical studies on whether zirconia restoration caused TMJ problems. What was the conclusion? The conclusion was that you cannot pinpoint the zirconia as the cause. It's not clear. It's unclear. However, I believe we need to pay more attention to this. That's my honest opinion. Last but not least, I'm going to talk about current trends, where we are today. I looked at aesthetics and physical property. The commonality that I've noticed is that the physical property required by the engineering side and the dental field is completely different. I believe that is the key in today's lecture. Because of such traits, zirconia is continuing to go through organic transformation. It was introduced in 2010s. The hybrid block is the most noteworthy example. The hardness is extremely low, however, it has good aesthetics and can be polished. You can fabricate it using CAD/CAM. You can make it at chairside. Because of these benefits and advantages, it is being used clinically. In the case of inlay, you can use hybrid block to provide one-day treatment, and a lot of dentists do this. That is the difference with engineering and dentistry. Even though it's weak, we're going to use it because it has many advantages. In terms of hybrid block, there are many different technologies that are used. There are ways to strengthen it in which composite resin cannot do. I believe hybrid block will continue to advance just like zirconia. Another point I would like to emphasize is that dental materials, physical property is important, but applicability in the clinical sphere is important. It is important to understand that for aesthetics and clinical applicability, physical property, which is of high importance in engineering, can be compromised. This is explanation on zirconia block, which is available in the market, high transparency. Over here, it is 1300 megapascal. The high transparency block is 600 megapascal. It's less than half. Some may think, how can you sell this? But aesthetics is important, and strong force is not applied in the anterior area, and therefore you may use these blocks. Ista is Osstem product. In the case of Ista Jet, it is 600 megapascal. Is that hybrid This is zirconia.
지르코니아죠. 이토리아
Depending on how much yttria content it has. Yes, that's why the hardness has dropped. However, in the past, we thought megapascal was very important, but this sells really nicely. It serves a purpose. In the anterior area, aesthetics is more important compared with mastication. Depending on different demands, there are various options available, and that is the market trend of today. Last but not least, I'm going to briefly mention ceramic 3D printing, which is being researched at home and abroad. There are commercial products available, but it is not clinically applied as of yet. For dentistry, as shown in the lower right, UV polymerization is done. It's the same with ceramic. You mix with resin and polymerize using UV. You burn off resin and then sintering is done. This kind of ceramic 3D printer has been released and research is being done. Then we come to this question. What are the advantages of ceramic 3D printing? For general people, there's no major difference between CAD/CAM and 3D printing. There are not that many advantages. Here it says there's less waste of materials. In general, this is the only thing. And the duration is not really short compared with CAD/CAM. It's lacking in terms of physical property and aesthetics. Considering these factors, does ceramic 3D printer really have any advantage? In terms of overall industry, dental restoration, it's very high value added material. And it's not really meaningful to save this much. Some people may think 3D printing does not have any advantages. So does it really have no advantages? But actually, it does have a few. In the case of 3D printing, I'm not sure whether you're aware of it, but different materials can be mixed. The ratio can be changed and fine-tuned, and it can be printed out. This cannot be done by CAD/CAM. This is a multi-layer block. Rather than distinctive interfaces, if you can mix it changing different ratio, there can be difference in physical property of materials. There's advantages in terms of physical property and aesthetics that can only be gained with 3D printing, and research is being done in this end. You mentioned this earlier, but multi-layer block has defined shades, but you can mix the desired shades. So it's good for the interior area, yes. You don't need to make by shade. You can mix different materials and get the desired shade. In this way, 3D ceramic printing can produce aesthetic results, and I believe this is a major advantage. In other words, this is a stock product. It's not ready-made. You can mix to make the desired color. Some patient, if they're younger and have thicker enamel, you can reflect that. For older patient, if they have less enamel, you can print that less. You can be flexible in doing treatment. As mentioned, the biggest challenge that we face today is you need to solidify using resin. You need to burn that off. You need to remove it completely. After that, you need to do sintering because it's zirconia. It takes time. It takes a lot of time. After you burn it off, it can be multi-porous after it is burnt off. And transparency also falls behind CAD/CAM. There are still many challenges that lay ahead. There are lots to improve, but I believe it has many potential. If it continues to advance, I think it will be a great material for implant restoration. If it reaches that level, hopefully you'll be insured. I hope that too. To add, I'm going to talk about the future. Implant dentistry, it's becoming more automated. With technology advancement, we have one guide, the guided surgery. Automated surgery is being done. CAD/CAM process is being automated. What is not automated is color matching. This is something we need to solve. Color matching will be ultimately automated, in my opinion. By printing, you can use printing to do that too. You can just measure the shade and you'll be able to get the color. I believe that will be possible in the future. You can utilize a ceramic 3D printer for aesthetic restoration. In the past, we thought the color matching required the lab technician's skill and expertise. The technique of lab technicians were of high importance, and that significance will decrease. You might remember at one point there were so many spectrophotometers available. However, despite this, you need to do manual work later, so it didn't really have a point. Now it's all gone. However, as we continue to automate, I believe spectrophotometer will make a return and will become a mandatory product. If you measure, you can get the value. You can measure the natural teeth and replicate it. Hopefully, fingers crossed, we'll be able to use those technologies in near term. I look forward to it. As I talked about where we are today in terms of zirconia, I talked about the future as well. I'm going to summarize. As implant prosthesis material, zirconia has become mainstream. However, there are still room for improvement. In order to be optimized for dental treatment, continuous research and endeavor needs to be made. This is the end of my lecture. Are you done? Thank you for the wonderful lecture. It was very interesting, Professor. So let's look at some questions. A lot of questions have been received. ID 황르시, implants. At first, we used a lot of notable overseas products. Now, a lot of local products are being made. In the case of zirconia product, do you believe there is difference in technology between overseas and local products? As you all know, for implant, we used to use overseas products. And now we mostly use the local product, domestic. So in the past, the ratio between overseas and local is 9:1, but now we use Korean products 95% of the time. Yes, the technology gap was stark. In the case of zirconia, there's no difference. At present, I use a Chinese zirconia block. There have been many development, and I believe there's very little technical difference. I don't think overseas products are better than local products. However, one thing that is in dire need of attention is the material of zirconia. They're all from overseas. Zirconia powder is mostly from Japan and partially from Germany. 100% we're using zirconia powder from overseas, therefore perhaps we can study further and localize the material itself as well. The Ivoclar multi-block or Korean block, Chinese block, the block itself, it's not really different. However, the material of the block is from either Europe or Japan. Therefore, we need to develop on that. Do we have a lot of zirconia in Korea? There are many zirconia companies. The element. It's the same with titanium and zirconia. In terms of element, it's common. You need to refine it, and the technology, the proprietary technology, making it into industrial usage, that's important. Technologies for refining it and advancing it. That's why we need to work on. In other words, it's the same as buying cabbage from China and making kimchi. We need to make our own kimchi and add a flavor to it to make it a true Korean kimchi. In the same sense, so we need to localize the material to be able to produce Korean products. Little Prince, you need to understand material well in order to reduce the percentage of failure. Thank you for the wonderful lecture. ID OWTYSKHK. I really am enjoying your lecture. It's of great help. When you do occlusal adjustment or do polishing, if you use diamond pearl on high-speed handpiece, can a physical property of zirconia deteriorate? I forgot about this. I'm sure you already know about this, but the physical property goes down really bad if you use high-speed burr. The fact that you touch it with high-speed burr is that you're cracking it. The tetragonal phase is going to change to monoclinic phase, and the surface changes as the same as general porcelain. It's not going to have good physical property. Grinding and cutting it off, it's very negative. If you look at the characteristics of zirconia, if you apply heat, even if you don't apply up to 2000 degrees, when you do polishing, it goes up 200 to 300 degrees. Even with that temperature increase, the phase can change. Therefore, grinding it off can accompany deterioration of physical property. You need to squirt some water when you do polishing. You need to be careful when you do this. Be aware of the heat. In the case of occlusal adjustment, you need to cut it off a little bit. It's okay to cut the antagonist a little bit, but you cannot do that significantly. In this case, rather than doing high speed, what if I use low speed and other stone burr instead of diamond burr? I think that'll be worse. High speed, it squirts water. The zirconia's physical property, it is very hard. Diamond needs to be used to be able to cut in a clean manner. The weaker the material, it's going to break and crack more. So you need to use the material with high hardness like diamond. Thank you. Thank you for the question. Hooray, Professor An Jin-soo. I love the lecture. South Seoul Dental Clinic, when I provide zirconia prosthesis and implant patients, I make the bite lower than gold prosthesis. You need to consider the wear that's going to happen as well as the alteration. So maybe underbite would be better. As of late, I have not provided clinical treatment. Through regular checkup, if occlusal adjustment is necessary, you can do adjustment. However, I believe you do not need to provide underbite from the start. When I was providing implanted treatment at the time, everyone thought we need to make the bite lower. But that's not the case anymore. You need to make nice occlusion for the patient. Implant has improved, and the general opinion is that you do not need to worry about the occlusion. In the same sense, regular occlusal check is necessary, but you do not need to make an underbite. Understood. ID exciting weekend. In the test, you found out that antagonist wear occurs less in zirconia compared with porcelain. My understanding is that antagonist wear occurs more in porcelain compared with gold tooth due to the fact that it's harder. Although zirconia is harder, you said that the wear on antagonist is smaller. Why is that? It's the same with the explanation that I've provided. The molecule of zirconia is very soft and it has a lattice structure. Because of the structural difference, I think the result came to be. I like to give you an example. If the hardness is strong, there's higher resistance to wear, but the biggest exception in the material field is the tire of an automobile. The tire has low hardness and is soft. However, wear does not really occur in this material. Therefore, the basic principle does not always apply. ID Yongyong, what options are available today to replace zirconia implant prosthesis? Nothing really comes to my mind right now. Is there something new? Zirconia has overrun gold now. People rarely use gold. Gold is a very good material, but it has been overrun for multiple reasons. Are there any new materials available in the market? Is there something that comes to mind? There are many candidates available. Among the high molecule materials, although composite resin is high molecule, you need to do polymerization within patient mouth, so it's not hard. If this can be fabricated in factory, perhaps we can use a stronger material. For instance, we can use PEEK. This is a type plastic. This is methyl methacrylate. It is stronger than resin. Such high molecule materials perhaps can be used for permanent prosthesis. A lot of candidates are being introduced, but it's difficult at present to win over zirconia. PEEK, it's not done within the oral cavity, but you fabricate it outside of patient's mouth, yes. ID Toto, if you do sintering, it shrinks. How does the hardness change? For zirconia? Before sintering, zirconia's hardness is very low. You need to do sintering, and shrinking needs to occur for it to become harder. ID Aya, there are so many questions, it's so interesting to see them. It was quite difficult for me though. I believe this is the end. This seems to be all of the comments and questions as well as words of encouragement. There are so many of you who have made comments and questions. The time's almost up. I believe it's time for Professor An to select one winner of dental set from Music Tiger and Busan. Which do you think is the best question? Which was the most unique and best question? Do I need to choose one? Yes. We want to give out more, but you just need to choose one. I believe there was one person that allowed me to explain more about hybrid blocks. Which question? The difference between hybrid block zirconia and existing zirconia. Hand piece? I didn't write down properly. Hot dog 7? So, I wanted to ask you a question. There are many zirconia hybrid blocks available. What is the difference between existing zirconia and hybrid block? Is this the question you were looking for? Another one? Another question that came to mind was the one... Please scroll down. Another good question. The one about occlusal adjustment. This one was very important. OUTYSKHK. This question. ID OUTYSKHK. Thank you for the wonderful lecture. When you do occlusal adjustment or do polishing, should I use a diamond burr with high-speed handpiece? Does it cause a negative impact to zirconia physical property? Congratulations. I'm unsure as to how to read your ID. OWTSKHK. Congratulations once again. I'd like to give out one more. The person asking about the hybrid block. The one on top. Hybrid. Hotdog 7. Professor Anjin, so I wanted to ask you a question. A lot of zirconia hybrid blocks are released. What is the biggest difference with the existing zirconia? Dental set from Music Tiger and Busin is going to be given out to this person as well. Thank you. Congratulations, two of you who have been chosen. The real-time chat event continues on prosthodontics on Friday, so please try your chance next time as well. Thank you, Professor An, for your wonderful lecture. Is there a word of advice you'd like to give to your peers who are watching and studying prosthodontics on Friday? Up until late, I focus on basic science. You also studied prosthodontics. It's not because I focus on basics, but I would like to emphasize that basic knowledge is very important. If you have a basic knowledge established, you can utilize it to go on to another level. You can use that as a basis to upgrade yourself to a whole new level. Thank you, wonderful. Despite your busy schedule, thank you for coming in to prosthodontics on Friday. Dear viewers, did you enjoy prosthodontics on Friday with Professor An? Zirconia for implant prosthesis. We were able to gain a lot of information on this, and I'm sure you've learned a lot. As for the questions that were not answered in this program, these will be addressed via reply. Next time, Professor Kim Jong-un of Yonsei University is going to talk about how much progress digital implant prosthesis has achieved. Thank you for staying with us till late.
감사합니다. 수고 많이 하셨습니다. 감사합니다.